Coming up on Mayo Clinic Q&A.
Some of the very common issues that cancer survivors deal with include fatigue, distress, the anxiety and emotional distress of dealing with the diagnosis and with the ongoing therapies for some people can be really significant, and even transitioning out of treatment can be a distressing experience.
Living with cancer is different for every person. And at Mayo Clinic, cancer survivorship focuses on the well-being of the patient from diagnosis through treatment and beyond. It's help with the physical and mental aspects when coping with cancer.
Our social workers and psychologists provide a really important type of care for our patients. Physical medicine and rehab to help with physical dysfunction, pain management is very important. It's really a very multidisciplinary practice that we bring to caring for our cancer survivors.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. June is National Cancer Survivor Month, dedicated to recognizing and celebrating the millions of adults and children in the United States who've experienced a cancer diagnosis. According to the National Cancer Institute, there are nearly 17 million cancer survivors in the US, and each one of them experiences cancer survivorship differently. Some are living with cancer, some are cured of their cancer, and some are suffering from long-term side effects of the treatment of their cancer. Joining us today to discuss cancer survivorship is medical oncologist Dr. Kathryn Ruddy. Dr. Ruddy is the Associate Director of Patient and Community Education and co-chair of the Symptom Control Survivorship Cross-Disciplinary Group at the Mayo Clinic Cancer Center. Thanks for being here today, Dr. Ruddy.
Thanks so much for having me.
I wasn't sure I could get that title out. That was a long one. I thought I was going to trip on that. Well, thank you so much for being here. I find this topic fascinating because I think we think so much about treatment of cancer, but we don't necessarily think a lot about what happens after people have treatment for their cancer. And how wonderful that so many people are being cured or surviving, such that this is a hot topic.
Absolutely.
Katie, can you tell us how you define cancer survivorship?
Well, it's interesting. I think some people do think of survivorship as starting after cancer treatment, as you kind of alluded to just now. But I tend to think of it as actually starting kind of at the diagnosis of cancer and then going on through the rest of life. So for lots of people, that means the time during treatment and then after treatment. For some people who need indefinite treatment for their cancer, it means that they're always getting some type of treatment, but the survivorship periods kind of goes on throughout that.
Well, that is interesting because you're right. I didn't think of it that way. I've already learned something today. That's always my goal.
Well, it's not that there's one right answer. That's just for me. That's how I define it.
So, Katie, what is important about cancer survivorship? What kind of physical and emotional needs do patients and individuals have after a cancer diagnosis?
Well, it differs a lot from person to person, as you'd imagine. Some related to the fact that people are getting all different types of treatments that have different side effects. Some of the very common issues that cancer survivors deal with include fatigue, because lots of our different types of treatments can cause that. Distress, the anxiety and emotional distress of dealing with the diagnosis and with the ongoing therapies for some people can be really significant, and even transitioning out of treatment can be a distressing experience. There can be issues related to finances. The financial stress related to loss of work or medical costs can be significant. And then there are also physical side effects, things like numbness and tingling of the hands and feet for people who get chemotherapy that can cause that. So it's really a wide variety of issues that can happen.
Well, I personally have experience with having patients come into the pain clinic to see me who've had chemotherapy-induced neuropathies or other pain syndromes, or even just long-term chronic pain after their cancer treatment. So I'm kind of familiar with that. What other kind of medical care do individuals need after a diagnosis of cancer, or even after their treatment is completed?
Well, our social workers and psychologists provide a really important type of care for our patients. It is just, as I mentioned, such a stressful experience that we try to engage our social workers and psychologists often and really offer that to all patients. And not everyone wants to take advantage of that, but that's certainly a key piece of care for a lot of people. Physical medicine and rehab to help with physical dysfunction, fatigue. That's a very important. As you mentioned, pain is a very common side effect, both the related to the chemotherapy, but also to all sorts of other parts of cancer treatment, including surgeries and radiation. And so pain management is very important. It's really a very multidisciplinary practice that we bring to caring for our cancer survivors.
What are some of the most common long-term side effects requiring treatment? You mentioned pain and a couple of other ones, but what are some of the long-term physical side effects that are left after cancer at times?
Well, it's so different from person to person. I'm a breast oncologist, so one of the symptoms that my patients often are dealing with is hot flashes. And of course, many women have hot flashes when we go through natural menopause, but breast cancer treatments can make that worse. Sometimes women go through menopause at an earlier age and more rapidly because of breast cancer treatments. And our women's health clinic is provides really important care to help people reduce the amount of hot flash burden. Hot flashes can interfere with sleep, and insomnia can be a really, really big problem, both related to hot flashes and otherwise. And so we have a sleep clinic here, but we also have people in the women's health clinic who help with kind of reducing the night sweats and hot flashes that for some people are a really big problem overnight.
I think one of the key things that I got out of what you just said is that if people have side effects, they should ask about them because there may be solutions for them. I think sometimes we think, well, I've had, an individual might think I've had cancer, I've had treatment, so this is to be expected. I should just be grateful for what I have. But I think knowing that there may be symptom management available is really important.
Absolutely. It's really important to talk to your provider. It's about these symptoms, about any symptoms that you're having. But there are things that can be done. Dr. Chaville, who's one of the PM&R doctors, the rehab doctors here at Mayo Clinic Rochester, has a huge project right now ongoing to assess symptoms prior to every medical oncology visit in Rochester and also through the Midwest health system. And this is really important. It's an incredible step forward because it is encouraging us to communicate about these symptoms even prior to visits. And as part of her study, she has nurse symptom care managers involved to help us better address certain symptoms. Now, that project doesn't address every symptom, but really, I hope it will get people talking more to their oncologists about all sorts of types of symptoms so that we can offer the best treatments we can.
That's great. Awareness is important. In the intro,
Absolutely.
Katie, I mentioned that there are children surviving cancer as well, and I imagine that they and their families have very unique needs. What would some of those be?
Well, you're absolutely right. For one thing, the cancers that afflict children are quite distinct from those that are common in adults. So treatments and expected long-term symptoms are not the same. And so I'm not a pediatric oncologist. So in my practice, I'm not seeing children or childhood survivors. I do see adolescent and young adult survivors. The breast cancer is one of the common cancers in young women. And we usually define adolescent and young adult as actually going up to age 40. So we do have many young women in our clinic who actually can experience more severe side effects sometimes due to our breast cancer treatments because of the sudden menopause, going into menopause at age 30, or at least your body feeling like it's in menopause at age 30 comes with some pretty severe side effects at times, vaginal dryness, sexual dysfunction, things that if you went into menopause at your normal age, at 50 or 55, at an average age, would come on more gradually and potentially be less of a burdensome symptom. So in terms of actual children and teenagers who are having cancer and who are surviving, of course, there are all sorts of a wide variety of symptoms that can happen. And really the experience of cancer is often both very difficult for the children, but also for their parents. And lots of supports are needed to help manage those.
So tell us a little bit more about some of the unique things that Mayo Clinic is doing to help care for cancer survivors.
Well, I don't know if you've been to our cancer education center, but we in Mayo Clinic Rochester, we've had this wonderful cancer education center, the Slaggy Center for years. And now we're actually in the midst of trying to, and there are also wonderful educational offerings at our other sites in Florida and Arizona and health system. Right now, what we're working to do is to really bring all of that together under a new education committee that will allow patients across the whole Mayo enterprise and even outside of Mayo to access these resources virtually as
Oh,
well
that's
as
wonderful.
in person when on site. But I think one thing that the pandemic has really helped to move forward is our figuring out how we can get these resources out to people, make them accessible, even for patients who are living 10 hours away from here or who are being seen at other sites, for people to be able to get the information that they need about symptom management, about surveillance, about psychosocial supports. And that's really, I think, an exciting effort. We also have Mayo Clinic Connect, which is a social media connectivity for patients to find others who might be experiencing similar things and to have conversations virtually, and to get support through a moderated platform. So these are things I'm really excited about, and I think we'll see continue to grow over the years to come.
I'm really glad you mentioned the virtual availability, because that's been one of the things that the silver linings of COVID that I think many of us have seen, and we're always looking for silver linings. But we've talked so much about virtual visits and how we are offering those even from our oncology department, but also there's a lot of virtual information that people can access. And so I think that's wonderful that that we have that available and are even kind of working on that program.
I agree.
Katie, supposing that an individual is nearing the end of their cancer treatment, what questions should they ask their doctor at some of their later appointments to prepare them for what things will look like in the future and what they should be watching for?
Well, I think some of the important questions are, of course, what kind of care is going to be needed? When do I need to come back? Who do I need to see? What kind of testing will I need, or if any? But then also lifestyle wise, what can I do in between those visits, whether that's medications I can take or not take, or exercise or diet? Are there things I can do to help me feel better or have a better outcome in various ways? Those are the conversations I think are really optimally, we should be having those throughout the cancer journey, both from the time of diagnosis, but at the end of treatment is a nice time to kind of have those conversations again and to help with the transition out of a more frequent visit schedule into something that's probably going to be coming back, mean that patients are coming back less frequently. It's nice to kind of talk about, okay, what can I do at home, and when do I need to come back?
I think that would help a lot with uncertainty. If people have a plan in place, that's always good. Knowledge is important.
Yes, I don't know if you've heard about survivorship care plans, which are kind of refer to a document that summarize all of that. And survivorship care plans are great. We love when we can get when we can provide those to patients, but there's also just a real value to that conversation, and talking it through. And of course, for people who sometimes all the visits can be very overwhelming. So people should feel free to reach out again to clinicians if they're confused or can't remember what was said, or sometimes it's hard to absorb and retain all of that
Right.
information at once.
Okay, do we talk a lot about clinical trials for cancer and ongoing treatment for patients and various disease states? What about cancer survivors? Are we doing research at Mayo Clinic on and with cancer survivors?
We are. Well, I mentioned Dr. Cheville's really phenomenal symptom management study, which is called E2C2. That's actually funded by the National Institute of Health, and it's part of a much larger effort to better assess and manage symptoms across the country. And the symptoms I should mention on that study, the specific symptoms that are being addressed are insomnia, pain, anxiety, depression, fatigue, and physical dysfunction. So it's kind of 6 specific things. It doesn't cover everything. It doesn't, for example, specifically address numbness and tingling. But it's hard for any one study to cover every symptom. It does cover what we think are the very common symptoms that can occur across really all cancers and across all types of treatment. And that's how this was developed. But there are other studies too that are a little more focused, focusing in clinical trials, sometimes focus on a particular medication or a particular type of exercise. And those are varied across the enterprise. Dr. Chevil's study is the largest study I'm aware of that's currently ongoing, that's both in Mayo, Rochester, and across the entire health system.
Katie, are there, we're talking so much about healthcare disparities, and we've talked about virtual medicine as a way to be able to provide some equity and provide care in areas and to individuals who might not be able to readily receive it. Are there healthcare disparities related to cancer survivorship that we should be aware of?
Yeah, unfortunately there are, and this is an area of research and growing research. We really want to do better with reducing these disparities. Some of the issues are related to geographical and financial barriers to care. Anything that makes it difficult to access healthcare can contribute to inferior outcomes for patients. And so it's important that we work hard to minimize these barriers. Here at Mayo Clinic Rochester, one of the issues is we're hard to get to for a lot of people. So figuring out what we can provide virtually, as we talked about earlier, how can we get our resources out and available to people who maybe live afar or have other barriers to getting here, is part of what I think we're making progress on, but we need continued work on.
Well, as we are celebrating June, National Cancer Survivor Month, what else would you like caregivers and patients to know about cancer survivorship?
We're here for you. If you have questions, please talk to your caregivers. If you're a Mayo Clinic patient, please check out Mayo Clinic Connect, incredible resource. Mayo Clinic Connect is actually a sort of entry point for our cancer education offerings of various sorts. National Survivors Day is coming up, although this year, instead of having a single day where we gather survivors in person, we're actually having a month of celebration throughout June. Every Monday in June, there'll be a new talk posted on Mayo Clinic Connect, hosted by our Cancer Education Center, focusing on different cancer survivorship topics. And on the last Monday of June, there will be a talk by a survivor, a really inspirational talk. The talks will actually be available for access then afterwards for some period of months. And so please check it out, and we hope that these will be useful.
Oh, that's wonderful. Thanks for sharing that. And thanks for being here today, Katie.
Thanks so much for having me.
It's wonderful. Our thanks to medical oncologist, Dr. Kathryn Ruddy, for joining us today to talk about cancer survivorship. I hope that you learned something. I know that I did, and we wish each of you a very wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.